about 10% of patients will have lymphadenopathy, which is just meaning swelling of the lymph nodes in that armpit of the site that the injection is given. And after the second, they saw as much as 16%. So with that, we have to pay attention because we also know that we can get enlarged lymph nodes with breast cancer diagnosis.
We have observed a small percentage of our patients presenting with enlarged lymph nodes following the vaccine. This is a small percentage of patients. This is a benign finding, nothing to be alarmed about. This will resolve. The important thing to note is the vaccine does not cause abnormalities in the breast. It's also important to note that having the COVID vaccine does not limit our ability to find breast cancer on imaging.
The bottom line is, despite the fact that we're having this, we do not want women to continue to delay getting their mammograms, because if we think back from this last year, we've had a 50% decrease in diagnosis and women are getting diagnosed at more advanced stages. So I don't want this to be an excuse for women to not get their mammogram. We are absolutely recommending that if you have a known diagnosis of breast cancer, we want you to get it in the opposite arm. It has seen on an average of about 12 to 14 days is when a lot of it is starting to resolve. It has been as long as 4 to 6 weeks in some.
From an imaging perspective, we can often tell if lymph nodes are reactive simply to a vaccine as compared to due to breast cancer. And if the breast is normal and the lymph nodes have a very specific appearance on ultrasound, we're pretty good in breast imaging about being able to identify these as due to the vaccine and not breast cancer.